Hey guys, so I'm sorry I haven't been updating about things, and I thought maybe it'd be a good time to seriously actually give you guys a little bit about my life, how I deal with this, and what is the hardest thing to deal with it. So, high blood pressure is a common disease in which blood flows through blood vessels or arteries at higher than normal pressure. Blood pressure is a force of blood pushing against the walls of your arteries as the heart pumps blood. High blood pressure is sometimes called hypertension, which is when the force against the artery walls is too high. Your doctor may diagnose you with high blood pressure if you have constantly high blood pressure readings. To control or lower high blood pressure, your doctor may recommend that you adopt heart-healthy lifestyle changes, such as heart-healthy eating patterns, like DASH eating plan. Alone or with medicine, controlling or lowering blood pressure can also help prevent or delay high blood pressure complications, such as chronic kidney disease, heart attack, heart failure, stroke, and possibly vascular dementia. So, I'll give you guys risk factors, which is actually how they diagnose it, confirm high, wait, hold on here, risk factors, hold on, causes. Alright, so eating too much sodium. Unhealthy eating patterns, particularly eating too much sodium, are a common cause of high blood pressure in the United States. Healthy lifestyle change, such as heart-healthy eating or the DASH eating plan, can prevent or treat high blood pressure. Do you know sodium causes blood pressure to rise? Other medical conditions change the way your body controls fluids, sodium, and hormones in your blood. Other medical causes high blood pressure include certain tumors, chronic kidney disease, overweight or obesity, sleeping apnea, thyroid problems. Look for risk factors. We'll discuss family history, lifestyle, and other factors that increase your risk of developing high blood pressure. Treatment, we'll discuss heart-healthy lifestyle changes that your doctor may recommend if you're diagnosed with high blood pressure. Risk factors, which is age. Blood pressure tends to increase with age. Our blood vessels naturally thicken and stiffen. Over time, these changes increase the risk of high blood pressure. However, the risk of high blood pressure is increasing for children and teens, possibly due to the risk in the number of children and teens who are living with overweight or obesity. Want to learn more about molecular changes that happen in your blood vessels as you age? Family history, genetics. High blood pressure often runs in families. Much of the understanding of the body system involved in high blood pressure has come from genetic studies. Research has identified many genes variations associated with a small increase in the risk of developing high blood pressure. New research suggests that certain DNA changes during fetal development may also lead to development of high blood pressure later in life. Some people are high sensitive to sodium that can run in in families. Unhealthy lifestyle habits. Unhealthy lifestyle habits increase the risk of high blood pressure. Those habits include unhealthy eating patterns, such as eating too much sodium, drinking too much alcohol, being physically inactive. Race or ethnicity, I think I'm saying that right. High blood pressure is more common in African American adults than in white, Hispanic, or Asian adults. Compared to others with racial, genetic, ethnic groups, African Americans tend to have higher average blood pressure numbers and get high blood pressure earlier in life. Okay, so before age 55, men are more likely than women to develop high blood pressure after the age of 55. Women are more likely than men to develop high blood pressure. So, screening and preventions. Your doctor will use a blood pressure cuff. Your doctor will use a blood pressure test to see if you have higher than normal blood pressure readings. This reading is made of two numbers, a systolic number and diastolic number. These numbers are measured pressure in milliliters of mercury, and mmHg. Your blood pressure is considered high when you have constant systolic reading of 140 mmHg or higher, diastolic reading 90 mmHg or higher. Based on research, your doctor may also consider you have high blood pressure if you are an adult or child age 13 or older. Has constant systolic readings of 130 to 139 mmHg or diastolic readings to 80 to 89 mmHg. You have cardiovascular risk factors. For children younger than 13, blood pressure readings are compared to readings common for children at the same age, sex, and height. Read more about blood pressure for readings for children. Talk to your doctor if your blood pressure readings are consistently higher than normal. No, that reading above 180 or 120 mmHg are dangerously high, then require immediate medical attention. So my blood pressure is in the 120s range, and that's pretty good for me because my heart rate's really low when they check my BP sometimes. And the last time they checked my couple weeks ago, they were checking my BP and it was at 180 over 109, and my heart rate was a little bit high, so they had to do a EKG, and that was like, a lot of so, alright, so talk to your doctor if your blood pressure readings are okay. A blood pressure test is easily painless and can be done in a doctor's office. A clinic health provider will use a gauge, stethoscope, or electrical sensor, and a blood pressure cuff to measure your blood pressure. To prepare the following steps. Do not exercise, drink coffee, or smoke cigarettes for 30 minutes before the test. Go to the bathroom before the test. For at least 5 minutes before the test, sit in a chair and relax. Make sure your feet are flat on the floor. Do not talk while you're relaxing or during the test. Uncover your arm for the cuff. Rest your arm on a table so it is supported at the level of your heart. If it's the first time your provider has measured your blood pressure, you may have readings taken in both arms. Even after taking these steps, your blood pressure readings may not be accurate for other reasons. Okay, so this is really true. You're excited or nervous. The phrase Wacol hypertension refers to blood pressure readings that are only high when taken in the doctor's office compared with readings taken in other places. Doctors can detect this type of high blood pressure by reviewing readings from the office and other places. If your blood pressure tends to be lower when measured at the doctor's office, this is called masked high blood pressure. When this happens, your doctor will have difficulty detecting high blood pressure. The wrong blood pressure cuff was used, which happened to me tremendously amount of times. Your readings can appear different if the cuff is too small or too large. It is important for your healthcare team to check your readings over time and ensure the correct pressure cuff is used for your sex and age. Your doctors may run additional tests to confirm intental reading to gather more information about your blood pressure. Your doctor may recommend wearing a blood pressure monitor to record readings over 24 hours. Your doctor may also teach you how to take your blood pressure readings at home. My doctor is amazing. I love my doctors. So what you have to do, I'll actually teach you guys how to check your blood pressure. Pretty easy and simple, which is I'll do now. So you really want to feel where your veins are at, like right in your arm. Now you want to slightly move to your left. You should feel a thump. If you guys don't feel a thump, press down just a slight more, and you should feel something. Now, if you guys are definitely wanting to know what's your blood pressure, they actually will listen to your blood flow in the body that's going in and out. So you guys would know that your heart is pumping like really easy and simple, going smooth, or, you know, just going way too fast. You know, that's kind of like common for a lot of people. Another thing that you should be warned about is that sometimes the cuffs can be very tight. They can go to like 160 to like even higher than that. I recommend using the right size of your arm because, like, you know, as I said, you guys got to measure your blood pressure the right way, or sometimes it just doesn't, look really good at all. So it's just very kind of challenging. So what I'm going to do is I'm going to show you guys how to do that with my arm, because I don't have a really nice arm, but I'll show you guys what I mean. So in other cases, you could have narrowed arteries and narrow veins, which is I have, and that's called aortic stenosis, meaning I have a lot of heart disease problems, and I'll gladly show you guys the way to do it. So I'll try to flip the camera over. I think I can. Okay, guys, sorry about that. So you want to feel your arm, which is like right. You want to move your arm, hold on guys, I'll try to do it this way. Alright, so you want to have your bare arm out. Now, you want to, hold on guys, I'm going to see if I can do this. I'm going to try to challenge here. So, you want to start feeling around. You gotta, like, you know, press down. So, if you guys can't feel anything, you guys gonna have to press around just a little bit to find the artery, because the artery can be 4 pencils, it can be smaller than that. You gotta be like really cautious about what you're doing. So you're gonna feel where your vein is at. So you know where your vein is at. Technically the branched vein. And there, found it. It's right there. So that's where your vein is at, if the artery is at while you're wondering. So I found mine. So now if you guys end up wanting to know why can't doctors actually hear my artery that well? Okay, sometimes when you have the wrong size blood pressure cuff, or if your blood flow is very faint, that is very common for a lot of high blood pressure people. Another way to check how high your heart rate is, going to the neck or going to your wrist area, right under the thumb. Do not use your thumb to press on your other thumb, because that's where your pulse actually in your thumb. So do not do that. You want to press down slightly. You should feel, yeah, I already feel mine, so it's just easy and simple. Like, I've done a lot of learning about, like, where to find my arteries at, because I've been, you know, slowly learning things. So on the foot, it's very hard. Even on the leg, it's very hard. So you want to do one of your arms at least. Now, this is going to be sounding very strange. So your heart rate is different in both sides. Now, sometimes it can be like the same. Sometimes it can be different. This is going to be wacky. My heart rate is different in both arms and both legs. A lot of people kind of imagine, like, how is it so different? Like, how... Here's the truth about my life that I'll explain to you guys, just because I feel like I need to do it now, you know, to fully explain all the details of my life. I feel more comfortable explaining my life now that I've, made myself, feeling the right way to do it. So, inside your body, like inside my body, basically, I'll explain to you guys this. Inside my body, I have, okay, so like this is a full, yeah. So, imagine your arteries as 4 pencils, which is I'm going to find they're long. I'm hoping they're long ones.
Right now by giving at loveshriners.org. Thank you.
Thank you. That is very short, so I'm not going to do that one.
Will you join us in helping children?
It's very short. So, imagine you have 4 pencils on you, and you're about to draw a picture or like write down something, and you notice a lot of things. You notice that you have a fast heart rate. Now, that's really good for, that's a good sign that you know how your blood is actually moving in your body. Other than that, it's very hard to honestly understand what your body's doing, and it's very hard to adjust to what your blood flow is doing. So what I recommend doing, I recommend this for everybody. If you guys want to, learn about high blood pressure, I recommend doing a low sodium diet. So I'm on a DASH diet, and the DASH diet is very tasty and it's wonderful. It's perfect enough for me to actually eat because I can't eat sodium, like high sodium foods. My body ejects a lot of sodium. So what happens if I eat sodium? Like very high dose of sodium. Like I want to say, like way high sodium amount. So like, way over the roof. So what happens is that if I eat a lot of sodium or drink a lot of sodium, my feet tend to swell up. So that means my body's way full of sodium. And that's when my hands start to swell up. And that is when my legs start to swell up. You don't want any of that in your body, like inside your body at all. It's just excess like fluid that need to come out. So I recommend drinking tea because it is like a blood thinner, but it removes all the excess fluid really fast and simple, and it's more safe than going to the hospital and getting something done that's not even that great to honestly feel. So I recommend that, and just try to be careful like how much you do. I can't drink a lot of fluids because I have I have kidney failure. And so that's why I'm giving you guys a warning that kidney failure is very scary to honestly have. Heart failure is another scary thing to have. But, those are all those things that your body's going to go through no matter what. And I've learned my lessons of having high risk for both of them, because you gotta let yourself be brave enough to get your testing done or whatever. You gotta be super brave. You can't let yourself down. That's what I've been teaching myself for the last couple of years, is, you can't let yourself down. You really gotta be cautious about what you're taking, what you're drinking, and I've always had to be self-cautious about it. I never let, people be like, oh, you're eating, like, I've warned my friends this, like, I'm not gonna eat a lot of, I'm not gonna able to eat a lot of pizza. I'm not gonna able to drink a lot of soda. I'm not gonna able to eat, ramen noodles. I'm not gonna be able to eat, very high cholesterol, like high sodium cholesterol food. That's the thing. Like, I have to be on a strict diet. So tonight I'm actually doing chicken salads, and I'm gonna show you guys how I make my chicken salads for dinner. Other than that, I'm going to show you guys another great recipe that's really good for your heart health. I recommend that even if you guys don't know what your body is going through, just make sure you drink a lot of water and drink a lot of, just water, period. I've been doing that for a long time. I just drink a lot of water to, make sure that the excess fluid is out of my body pretty much, and I pretty much just like, try to be on the safe side. I don't let anybody just like, say, oh, it's so easy to have like high blood pressure. Actually, it's not. It's the hardest thing to go through because you feel like you can actually, be different, like you're fine, you feel fine, you feel great, nothing wrong. But the thing is like, there's gonna be big challenges that are gonna be like very hard to do, and there's gonna be, there's gonna be a lot of challenges that people do hate the most, It's because a lot of people always imagine, oh, it's so easy and simple to be having high blood pressure every single time. Actually, no, honey, honey, no, it's not. And it's always gonna be those hard kind of things, because like everyone just says, oh, it's so easy to do, but no. But as I was saying, because like high blood pressure is one of the hardest common things to deal with. Because when I was born with high blood pressure, I was like pretty much at age 5, I was put on a low sodium diet, and that was like pretty surprising. I didn't go to McDonald's a lot. I only ate like stuff that was like healthy enough for me, and then sometimes my family would take me to McDonald's, but that was it. I'm not gonna be like saying, oh, it's so easy to be honestly eating high sodium foods. Oh wait, I have high blood pressure, because like everyone says different things about it, and a lot of people always ask me the hardest things about having heart disease. Honestly, it's very hard because you can't really do a lot of things that you really want to do. You can't drive. I mean, I can't drive, so that's really hard on me. I can't, it's all hard, you guys. I mean, like, for real. I've taught myself the hardest lessons to fully be me, because, like, that's just me, I've told myself, hey, I'm not gonna be something, stupid that is dealing with high blood pressure, because, like, I honestly said that before. High blood pressure is not being easy at all. It's just really like a pain in the butt to honestly have it. There we go. It is pain in the butt to honestly have it, and you kind of think it's gonna be so simple and easy. Like I've taught myself, no, it's not gonna be easy. It's just gonna be constantly hospital visits, constantly getting a lot of medications, and then and there's something else I haven't told you guys about. I was born with a rare genetic disorder called Williams syndrome, obviously, and a lot of people always ask me, like, you have what? And I'm like, I have Williams syndrome, and people are just like, how do you have that? And, the thing is like, truth is like, it is very hard to honestly explain it all the time. So, I'm gonna do a huge video based on it, actually, more than likely, definitely next month, like next Tuesday, I'll be doing a video. Well, actually, no, I'm not gonna be able to do it next week. I'll be doing it the week after, because there's just a lot of things I want to, like, really share about my life that is very kind of difficult, and there's just a lot of things that you guys probably don't know. Then I feel like, I'm ready to honestly share my life, in a huge, like, vlog, finally. Living with a lot of issues in life that I was not expecting. A lot of people look at me like she's just a normal person, Like, I mean, I'm glad they do that. I mean, like, there's a lot of great people that out there in the world that think that I'm a normal person. Which is, like, the best kind of thing that my friends always say to me. They're like, you're just a normal human being, and I've told myself, like, I'm lucky that all my friends think that I'm normal, because, it was very hard to make friends, honestly, and it was very scary. It was very hard, because when I was little, I had a very hard struggle making friends. Everyone kind of thought, like in my school years, when I was going to, like to a lot of schools, there was just, like, a whole bunch of unexpected things that were generally, like, very hard to deal with. And, it was very hard to honestly make friends. I was lucky enough that I met a really nice guy that pretty much, accepted me who I am. And, he surprised me in so many ways that he accepted me. I was not expecting all my friends to honestly his friends to accept me who I am. And we became friends as well. So, I mean, I was not expecting the idea of my friends, accepting who I am. I was not expecting that. And the first thing that I said to my friend Noah was, I'm like, Noah, I need to tell you something. There's something I really need to tell you. And I hid it. I hid it for a long time. I hid it for a very long time. And I remember going up to my friend and I'm like, here's the truth. I have a rare genetic disorder. And he was like, what? And then, it just kind of stopped the world from turning for a minute there. Because I was thinking, okay, I can finally reveal my life. I can finally do this. I can finally do what I need to do to share my life. And, it took me a very long time to actually settle my life in. I was thinking, you know what, I can do it. I can do this. I can, finally let it all out. I can finally show who the real me. I don't have to panic. And I was just, kind of, wanting to let it all out. But then, when it was right when all my friends and I started talking for a couple months, I finally revealed the hardest thing about my life, was that I've, done a lot of, my life was very difficult, in the past. That was very hard. And a lot of people are saying, oh, it's so easy to be, honestly, in a different world, because a lot of people always think I'm in a different world, basically. And the thing is you can't let yourself be I am just a normal human being, people always think of that. And I've, they see on the outside, but they haven't, fully, say, oh, this is your life, what's your life like, and it's honestly very hard to reveal all my life, because, people will say, oh, it's just so easy to be you, isn't it? Actually, heck no. It's not easy to be in my shoes. There's a whole bunch of things that I really wish I could say, even on, on here. I want to literally say some stuff that I just don't know how to fully explain to you. And, I was 10 years old, and I didn't know that I was born with a rare genetic disorder. I thought I was just a normal kid, saying, okay, I'm just gonna act like a normal teenager, things will be totally easy. And bam, you're starting your teenage life, out of nowhere at age 10. You feel like you're gonna be fine with everything. And honestly, it was a disaster mode. I remember going to school for the first time having butterflies all over my stomach, and I just could not wait to start school, and actually have friends for once. It took me a very long time. And I remember coming out of nowhere, just meeting these really nice people, thinking, okay, this is gonna be an easy life, I can finally be accepted, I can finally hide my life, a little bit. And that's when I said, forget it. I'm just going to tell my friends my life. I'm not going to hide my life from my friends. I'm not going to tell them, I'm not going to hide anything from them. Even if I had to hide a secret or something, I do not tell them. I can't tell them the secret, but I can tell them my life, That took me a very long time. And I remember just, starting to open up a little bit about my life, right in school. It took me days to fully open up. It took me days. I'm not gonna lie. It was very unexpected things that were happening all at once, because, I was going through, going to school, and my friends were, asking me, why were you in they're like, why were you in a hospital? And, that's very hard to, it was very hard to tell them, hey, I'm very sick, this is my life, and I didn't want to scare my friends away. I didn't want to scare them and be okay, this is my life, here, read all this, I didn't want them to feel there was a big, huge problem. I did not want them to feel like I was mistreating them. I wanted to make them feel like I was treating them with respect, you know. And it was very difficult to honestly explain it to a lot of my friends, like, you know, from my childhood to, you know, all of my friends and a lot of my family. And it was very hard to, you know, fully explain, like, you know, all the challenges to a lot of people that are very new to me, that are in my life, you know. And it's like, oh, this is so easy to honestly explain. It's always the challenges that have been like, what's your life like? What can we do to help? What can we do to help your mom and you? And I'm very thankful for my family, honestly, for all helping me, like, out of nowhere. Because, like, because when I first started living in the hospital for a very long time, I remember, like, just being me, honestly, like, you know, because I was acting like my normal self, being funny, being weird, being goofy, you know, like, all the way. And I remember, like, this guy, his name was Lamon, and Lamon came into my room, and he started to do my IV for me, because I was like, I need the IV. So Lamon would come in, do my IV, make sure that I was, you know, doing okay with the IV and stuff like that. He would come in, make sure the IV bags are fully getting attached to my IV, making sure that everything was working fine. And he, like, the next thing was, like, very scary, because, like, Lamon was a really nice guy. I love them. And I haven't seen him in, like, forever. So it's been a long time since I've seen him. And I remember, like, him just, like, being really, like, super careful with me, and that was, like, the best thing. And then that's, like, all I remember was Lamon. Because he was, like, really nice guy, like, super nice. And, he worked on a cardiovascular floor, which was, like, really cool, because he knew, like, what was going on with me. Like, he knew, like, I was needing a lot of treatments and stuff like that, needing some tests or whatever. And, you know, so, like, that was, like, the best thing was, like, having a friend that would, like, understand my life, basically, in, like, one area, you know, because he'd be like, okay, you need this medication, you need this, you need this, and then he'll name all the stuff that I'm taking. He'll make sure that I'm, like, you know, really willing to take it, whatever medication I'm taking. He was making sure that my IV was actually okay, not coming out of my skin or anything. He was really, really, like, really good guy. So then my doctor finally, you know, comes in, checks on me, and I remember being, like, super shy in front of a cute doctor who was, like, very smart, very, like, you know, he was just way too smart to even, like, think about. And, you know, like, when my doctor, like, when my doctor would come into, like, the room, he'd be like, Bailey, and I was like, there you are. So then he'll come into my room and then chill out with me for a couple minutes and talk with me. And then he would go off to do the other patients. And so, funny thing was, my doctor always loved to come and see me first. Like, he was always excited to see me bright and early in the morning. He was like, oh, I'm so ready to do this, you know, because he was, like, really happy. And when I had my heart surgery, right? Oh, no, it was, the hospital stays. He would come into my room a lot, and he would talk to me to make me laugh a little bit, because he was always making me laugh. Like, I'm really lucky that my kidney doctor is, like, my friend to me. Honestly, like, he's the best. Like, I'm very lucky that he's still my doctor, matter of fact. Like, I didn't know if I was gonna end up getting a new doctor eventually, or what, but, like, I'm very glad. And I love my cardiovascular doctor. He's really funny, very, like, you know, he's very smart, very interesting to talk to. He's very, like, you know, open up about what's going on with me. Like, he's very open up about it. Because, like, most doctors were always, like, the doctors that I went to in hospital at the Hurley, it was very terrifying. How to explain this to you guys. So, I had a heart doctor that was in the Hurley Hospital. This hospital is like, very nice. And it's right in a dangerous kind of area, of course, which is Flint. And this, like, I fully said, I was like, I'm like, Flint is not my favorite area. So I, was like making sure doors were locked while my mom was driving me down there, making sure I was like safe and sound in the car with, something to drink or whatever, and, just making sure it's like fine. And when I first like met the heart doctor, he was like very kind of like, oh, like this is pretty much like the patient that and like a week later, I go back to my doctor, and she's like, Bailey, did you know that you have a blockage in your heart? And I was like, no. And I was like, what? I have a heart blockage? So she's like, yes, you have a heart blockage. And I was just like, what the heck? How did I get that? So the doctor's never seen it, like right through the angiograms. Never mentioned that I was gonna be probably needing a stent to like put in to remove the blockage. There was just a whole bunch of things that was kind of going through my head when she first said it. And I went out of the room because my mom had to talk to her, and they were drawing what the problem was. So it was very weird. And honestly, like, I just could not believe what they were honestly saying to each other. Like, it was very shocking that I was born with, oh, it's, a blockage, that's okay, Honestly, blockages are very hard to remove, and I don't know in the future reference if it's that, because they're saying that something was abnormal. They did not say you have a blockage. They did not say there's a blockage, because they were thinking, okay, the blockage literally moved down to my, like, the arteries inside the lungs. Like, they were saying something about that. And I'm thinking, oh my gosh, like, what just happened? Like, do I really have a blockage? And, when the doctor was saying, he's like, I'm gonna put you on a Holter monitor, which is a heart monitor that you have to carry around with you for 24 hours. I love those things. No, not really. They're not very fun, if you guys ask me. And I remember, like, okay, I got a Holter monitor, this is gonna be long, don't care, like, I gotta deal with this crap. Really don't want it. Like, no, don't want it. Like, I was so, like, sad for a while. Like, I had to deal with a Holter monitor. And the doctor was like, oh, honey, it's okay. You gotta, you just gotta deal with a, unexpected thing. So, I was not expecting any of that, to go through, saying, okay, so now what are we gonna do? And I'm like, sorry guys, my nose is running, like, kind of runny today. So, he was like, not the best doctor, like, ever. And I'm like, okay, this is gonna be it, like, I could talk to this other doctor, maybe he would know. And the other doctor was like, okay, we're gonna do a, like he was doing, when I first met him, he was requesting echocardiogram and all that stuff, and I had to get that done. And he looks at me, he's like, yeah, there's a blockage, and I did not believe it. And then I'm surprised the doctors were saying, we can leave it in. There's no problem with that. Like, I was very concerned that I was going to be, like, having issues with my breathing, which is I do once in a while. I honestly kind of, like, got very worried that my, but, like, that was, like, very kind of, like, nerve-wracking, was just, like, all those kind of facts, like, saying, oh, it's okay, honey, like, I was not expecting them to say, oh, we can definitely remove that, no problem. You know, I was like hoping they would say that, you know. And so I have high blood pressure, I have a blockage in my heart, I have aortic stenosis with narrowed arteries and veins. So I technically have 4 heart diseases that are like attacking me all at once, out of like millions and trillions of them still like around. And you kind of feel like, okay, there's gonna be a lot more to deal with, a lot of problems in my future. Like, why can't they just stop the problems? You know, because like I thought, you know, because like medication sometimes they work. It just depends on what your body's doing to it. Sometimes it doesn't work, you know, and that's why I had heart palpitations. I had chest pains. I still have chest pains, and I still have heart palpitations. It's annoying, guys. Like, trust me, it's very hard to deal with all this stuff. You guys would think, oh, it's just so very easy to honestly deal with all that. It's very hard in my life in general because there's just so much going on. So, that's part of my life, you know, because everyone's just like, oh, it's okay, honey, you got this, you know. Honestly, like, I'll do another one in a few minutes. I'll do another one tomorrow, guys. Like, I'll explain so much to you guys, like, on Friday. So, yeah, I'll explain a lot to you guys on Friday. Because, I have a meeting on Friday, but I'll, fully explain my life in different ways to show you guys what my life is very like, you know, is it hard, is it easy, don't know. There's a lot of things I'll explain to you guys. So, for now, I'm going to talk to you all later, and see you guys later.